The home healthcare team. When home health aides work for a Medicare certified home health agency, they are often members of a larger home healthcare team. Most clients that receive services from home health agencies have an acute care need, a chronic condition that has become worse, or has been recently discharged from hospital. Each member of the healthcare team has a role to play, and it's important to understand what your role is and when you should seek advice or assistance from another member. Members of the home healthcare team can be made up of different people, including doctors, registered nurses, licensed practical nurses, physical therapists, occupational therapists, speech therapists, medical social workers, volunteers, family, and friends. Doctors have a very important role in home care. They decide when home care is required. Their job is to diagnose disease or disability and prescribe a treatment. A referral from a doctor is generally required for an agency to provide home care. Nurses may be registered nurses or licensed practical nurses. They can be a case manager or supervisor. They could coordinate, manage, or provide care. They can supervise and train home health aides, or they can develop the plan of care and determine assignments. Physical therapists administer therapy in the form of exercises, heat and cold, massage, and ultrasound or electric therapy. They prescribe exercises that the home health aide may have to assist the patient to do. Occupational therapists evaluate and train clients to perform ADLs, or activities of daily living. Often, this involves using specialized assistive or adaptive devices, and they develop a treatment program. Speech-language pathologists diagnose and identify common disorders. They diagnose and identify disorders in swallowing and eating, and they develop a plan of care. They work on short and long-term goals, and they'll have directions and strategies for the home health aide to follow. The registered dietitian teaches clients and their families about special diets or dietary restrictions. They help determine nutrition and fluid requirements for people who receive nutrition through gastric tubes, or tubes that go straight into the stomach, or through the IV or intravenous. Medical social workers help to address the client's social and supportive needs. This can include access to housing, financial assistance, meal services, and counseling. Each member of the team works independently, but communication is essential to make sure the client gets the best care. A home health aide must communicate with other health professionals, as well as the client's family, friends, and other support people. Often the home health aide has the most contact with and knowledge of the client, so you may be able to notice changes in the client's behavior or strength that the nurse may miss. Your familiarity and knowledge of the client is vital to the healthcare team.